Obsessive Compulsive Disorder, OCD, is a mental health condition characterized by intrusive and persistent thoughts and behaviors. It can cause severe distress, making it difficult to manage day-to-day life. Knowing the 4 types of OCD can help you identify and understand your own symptoms or those of a loved one. Contamination obsessions. The first type of OCD is contamination obsessions, which involve recurrent unwanted thoughts or images that result in fear of contamination or harm. People with this type of OCD may have an excessive fear of germs, dirt, or illness caused by contact with contaminated objects or people. They may also experience intense anxiety when touching certain objects, such as door handles or public restroom fixtures. As a result, they often avoid any situation where they might come into contact with something that could be considered dirty, and constantly feel like they must keep their environment clean and may become increasingly anxious if their environment is not clean enough. Symmetry obsessions. The second type is symmetry obsessions, which involve obsessive thoughts about order and symmetry in everyday life. These thoughts often lead to repetitive behaviors that are done in order to maintain a sense of control over the environment around them. Some common behaviors associated with this type include arranging items in specific ways, such as items being lined up evenly on shelves or clothing being hung up neatly in the closet, counting steps as you walk, double-checking tasks for accuracy, and avoiding anything out of place. They may also experience extreme distress when something disrupts the perfect order they have created, which can lead to ritualistic behaviors such as repeatedly rearranging items until they are just right, such as door locks, stove knobs, or light switches. Hoarding obsessions. The third type is hoarding obsessions. People with hoarding OCD often struggle with the idea of throwing away possessions, even if these possessions are no longer useful to them. This type of OCD can cause significant disruptions in daily life due to clutter buildup and difficulty organizing items within the home environment. Additionally, people with this type of OCD may also struggle with guilt or shame associated with getting rid of possessions due to fear that doing so will result in regret later on. While some people collect items because they think they might need them one day, people with hoarding-based OCD often find it difficult to discard items due to feelings of guilt and attachment to them, even if they no longer serve a purpose in their lives. Intrusive thought obsessions. The fourth and final type is intrusive thought obsessions, which involve persistent and recurring ideas that are often violent in nature but not acted upon by the person experiencing them. Common examples include fear of hurting oneself or someone else physically or sexually, fear that one might become violent, fear of saying inappropriate words, fear that something bad will happen if certain rituals are not performed, and fear that one will act on an impulse without meaning to do so. Symptoms associated with this type can be particularly distressing because the person experiences intense anxiety even though they know their thoughts are irrational and will not actually act upon them. It's important to remember that there is no one-size-fits-all approach to treating OCD. What works for one person may not work for another depending on their specific symptoms and triggers. If you think you or someone you know may be suffering from OCD, it's important to seek professional help from a qualified mental health provider who specializes in treating this condition so that an individualized treatment plan can be developed based on your unique needs. With proper treatment and support from family and friends, it's possible to manage symptoms successfully and live a fulfilling life despite dealing with OCD every day. Please like, comment, share and subscribe.